Hi, I'm Elizabeth Breitbach. I'm a third year medical student and I am doing the year in Des Moines. And I'm going to talk to you about the inpatient internal medicine rotation. So this is one of your main 6-week rotations. The way we do it in Des Moines is we split it half and half. You do 3 of your weeks at Methodist Hospital, which is right across the street from where you live. And then you do your other 3 weeks at the VA hospital, which is just a short drive away, and you can drive there and park there. There's 4 Iowa students on this rotation at a time, so you're partnered with one student, and you'll be kind of together. You'll be on the same teams at each place, but each of you is assigned your own intern. The way the teams work here is that there's 2 interns on the teaching team, so you're each are assigned one intern, and then there's a third year resident that is kind of the senior resident overseeing everything, and then there's also the attending. Kind of the way a basic day goes on the internal medicine service is you'll get there probably around 6:30, 6:45 to pre-round on your patients that you're assigned. You're usually assigned anywhere from 1 to 3 patients. Once you're assigned a patient, you'll follow them usually until their discharge. So you'll pre-round on your patients, kind of see how things went overnight, get those updates and write your note. Sometimes there's a morning conference with the residents that you'll go to, but other than that, you'll kind of have a little bit of a chance to talk to your intern, talk about your patient, about any changes before you round with your attending, which is pretty much what the rest of your morning is usually doing rounding on the floor. Sometimes you'll do bedside rounds, and at that time when you get to your patient, it's your responsibility to present your patient and kind of present the plan that you want for the day for your patient. Usually those rounds, I think, are really interesting. You get to hear about all the patients on the floor, even though you're only following a few. Usually at the conclusion of seeing each patient, there's some discussion and some teaching from the attending about whatever case that is, if there's a really good teaching point. Then every day you get a free lunch. We have a noon conference every day with the residents, where usually a physician will talk about their specific area. The food's really good, and that's an hour long, and it's at Methodist Hospital also. And then the afternoons vary a lot from day to day. Sometimes you'll have a new admission and you'll get do a complete history and physical. So lots of times your interns will let you go by yourself first to do the workup, and you'll get to write up a note and get to practice a full presentation of your full history and physical, which is really good practice. And you get a lot of good feedback from your interns and from your senior residents on that. Some afternoons, the senior resident will pick some teaching points that you want to teach about, or they'll ask you kind of what you want to learn about. And then some afternoons, you'll have kind of formal lectures with attendings, where it's all 4 med students come, and then sometimes we have some DMU students who will kind of prepare. It's called like CBL. It's kind of similar to your first and second year CBLs, where you'll get a case and have to answer some questions about it. The nice thing about these CBLs is they're exactly the same as they are in Iowa City, and these topics that you talk about in each of your lectures are what the test is on at the end of the clerkship. So I think these lectures prepared me really well for the test. I just studied my notes from these lectures pretty much for the exam and did well on the test. Other things about hours, so usually you're done about 5 on weekdays. The schedule's a little different than in Iowa City, where in Iowa City they work 6 out of the 7 days a week, and I think that's it. The way we do it here is you usually do anywhere from 2 to 4 weeknight calls, where you stay until 8 or 10 p.m. Over the 6 weeks, and then you usually have to come in for 1 or 2 weekends where you stay the whole day for a 12-hour shift, which I think those are totally manageable. You'll be working with your intern again, and you'll still just be following the patients you're seeing. Maybe get some new admits, or at night lots of times you can go up to the ICU and see some procedures and stuff, which is really interesting. Some perks that I think are good about this rotation is I found that the residents and the attendings both love to teach, especially the senior resident on the service. They're not specifically handling patients on their own, so they're kind of just overseeing everything, and they would love to sit down with us and help us teach, help us with our exercises. Dr. Craig, who runs the Des Moines program, he is really involved in the inpatient internal med rotation, and he runs lots of the lectures, and he's just a great resource. He'll read, you can turn in any H&P to him that you write, and he'll take the time to go through and check all of those. He's really involved. Another thing that I really liked about this rotation is, especially at the VA hospital, it's a smaller hospital, so all the doctors kind of know each other, and it's really easy if you have, a patient that's being covered by the general medicine team, but for example, I had a patient who went and got a bronchoscopy with the pulmonary team, but my doctor was able to, talk to the pulmonologist and let me go in and watch the bronch and get to learn a lot from that. Or sometimes I would go down with my patients to radiology to watch procedures, and some days when it was slow in the afternoons, I would get to go down to the phlebotomy area and do blood draws. And so there's a lot of kind of, a lot of communication and within the hospital, so you get to do a lot of stuff, which I think is awesome. Also, you get money for food, so we got $150 to use at the cafeteria. And that was for like evenings when you had to stay, or just snacks or coffee or whatever. I think that's about it.